This is Chapter 1, Module 2, Anatomical Subdivisions. The learning objectives of this module are: describe the anatomical positions, describe the three major planes of the body or of an organ, identify the major body cavities and their subdivisions, and identify the serous membranes that line the walls and cover the organs of each body cavity. Studying superficial anatomy is to locate structures on or near the surface of the body. Superficial anatomy can be located by looking at a person while they are in specific positions. The anatomical position is the position a person would be in when they are standing with their hands at their sides and their palms forward. Their feet would be about shoulder width apart and their toes would be pointed forward. Another position, called the supine position, is where a person would be lying down with their face up, and the prone position is where the person is lying down with their face down. For diagnostic and clinical purposes, the body can be divided into imaginary planes and sections. These planes and sections can be used to visualize different structures both internally and externally. Dividing the body into planes is important, especially with radiology tools, such as the MRI, PET scan, and CT scan. A transverse or horizontal plane separates the superior portion of the body from the inferior portion of the body. A cut in this plane is called a cross-section. A sagittal plane separates the right and left portions. A mid-sagittal section is a sagittal section that passes through the midline of the body, dividing the body into equal right and left sides. A parasagittal section, in contrast, is cut parallel to the midline, dividing the body into unequal right and left portions. A frontal or coronal plane separates the anterior and posterior portions of the body. When a person is viewed while in the anatomical position, the abdominopelvic area can be seen. This area is below the rib cage and above the pubic bone. Imaginary lines can be created to divide the abdominal and pelvic area into quadrants and regions. The abdominopelvic quadrants are formed by two imaginary perpendicular lines that intersect at the navel. The terms for these quadrants and their abbreviations are used by health professionals in clinical discussions. These quadrants include the right upper quadrant, or RUQ, the right lower quadrant, or RLQ, the left upper quadrant, or LUQ, and the left lower quadrant, or LLQ. Keep in mind that the right or left describes the side of the person you are looking at, and not your own right or left as the observer. The abdominopelvic regions are mostly used by scientists studying anatomy. 4 imaginary lines intersect to create 9 different regions that help to give more precise or specific locations. These regions include the epigastric region, the umbilical region, and the hypogastric region. The umbilical region surrounds the navel. The epigastric region is above the umbilical region, and the hypogastric region is below the umbilical region. There is also the right and left hypochondriac regions, which are to the right and the left of the epigastric region. The right and left lumbar regions are to the right and left of the umbilical region, and the right and left inguinal regions are to the right and left of the hypogastric region. The locations of internal organs and structures can be described by using the abdominopelvic quadrants and the abdominopelvic regions as reference points. For example, the majority of the liver can be found in the right upper quadrant. This is where a health professional would describe the liver to be. An anatomist or scientist that studies anatomy might use the more specific abdominopelvic regions and would say the majority of the liver can be found in the epigastric region. Or a health professional may describe the pain a patient is having from appendicitis in the right lower quadrant, whereas a scientist may describe the diseased appendix as being in the hypogastric region. The body contains several body cavities, which are open areas containing an organ or organs that are surrounded by a serous membrane. These body cavities protect the organs from accidental shocks and permit changes in the size and shape of the internal organs by reducing friction and surrounding structures. The 2 main body cavities of the body are the ventral body cavity and the dorsal body cavity. The dorsal body cavity consists of the cranial cavity, which houses the brain, and the vertebral cavity, which houses the spinal cord. The ventral body cavity is located on the anterior side of the body and is divided into the thoracic cavity and the abdominopelvic cavity by a muscle called the diaphragm. The thoracic cavity is surrounded laterally and superiorly by the chest wall and is surrounded inferiorly by the diaphragm. This cavity can be divided into two pleural cavities that contain the lungs, and the mediastinum that contains the pericardial cavity. The right pleural cavity surrounds the right lung, and the left pleural cavity surrounds the left lung. The mediastinum is the area between the right pleural cavity and the left pleural cavity. The upper portion of the mediastinum contains structures such as the trachea or windpipe, the esophagus, the thymus gland, and the major blood vessels from the heart. The lower portion of the mediastinum contains the pericardial cavity that encloses the heart. The abdominopelvic cavity contains all the organs of both the abdominal and pelvic regions. The abdominal cavity is the superior portion of the abdominopelvic cavity and extends from the diaphragm to the top of the pelvic bones and contains digestive organs. The inferior portion of the abdominopelvic cavity is the pelvic cavity, and it contains the reproductive organs, the rectum and the urinary bladder. A chamber within the abdominopelvic cavity is the peritoneal cavity that extends throughout the abdominal cavity and into the superior portion of the pelvic cavity. The peritoneal cavity would include the majority of the organs of the abdominopelvic cavity except for the gonads, other reproductive structures, and the urinary bladder. Surrounding these cavities and the organs within them are serous membranes that help to reduce the friction caused by movement and expansion of the internal organs. Each cavity has its own serous membrane. Each pleural cavity has a serous membrane called the pleura. The pericardial cavity has a serous membrane called the pericardium, and the peritoneal cavity has a serous membrane called the peritoneum. The serous membranes consist of two layers, a parietal layer that lines the cavities and a visceral layer that covers the organ. In between the two layers is a space that is filled with serous fluid. This serous fluid is a lubricant that allows the organs to expand and contract without catching on surrounding structures. In more detail, the thoracic cavity contains the right and left pleural cavities. The right pleural cavity contains the right lung, and the left pleural cavity contains the left lung. The pleura is the serous membrane that lines each pleural cavity. The parietal portion of the pleura, otherwise called the parietal pleura, lines the chest wall, whereas the visceral portion of the pleura, also called the visceral pleura, is closely adhered to the lungs. The thoracic cavity also contains the pericardial cavity within the mediastinum. The pericardial cavity is lined by the pericardium. The parietal portion of the pericardium, called the parietal pericardium, is the outermost layer of the serous membrane that surrounds the outer edges of the pericardial cavity. The visceral portion of the pericardium, also called the visceral pericardium, is closely adhered to the heart. The peritoneal cavity is a chamber within the abdominopelvic cavity that is lined by the serous membrane called the peritoneum. The parietal portion of the peritoneum, also called the parietal peritoneum, lines the internal body wall, and the visceral portion of the peritoneum, called the visceral peritoneum, covers the many organs of the peritoneal cavity. There are some organs in the abdominal cavity that are not enclosed by the peritoneum. They sit between the peritoneum and the musculature of the body wall. This space contains several organs, including the pancreas, the kidneys, the ureters, and parts of the digestive tract. This is a main reason why patients will often experience back pain rather than abdominal pain with kidney or upper urinary tract infections. This ends Module 2 of Chapter 1.